Julie and Nikki reached out to me a few months ago. Julie knew me because she had my husband as a teacher, and she knew that I was a nurse, and she reached out to me just wanting to talk through their new project. And it was the first time I'd heard of it, and we just did a lot of sort of brainstorming. It's not in my area of expertise by any stretch, but having been a nurse in this community for 28 years. I know the community and helping them kind of think through moving forward. So Tandem is their project. It will be an independent birth center. And I'm going to let Julie and Nikki take over from here.
Great. Thank you so much for having us. I'm going to go ahead and share my screen. I have some slides prepared for you all. And while I'm presenting, I may not be able to see all of your faces, but if you have audio issues, if you want to chat me to say you can't hear, sometimes I've had audio issues. And you're welcome to interrupt as we present and ask questions, or we can also take questions at the end. So Tandem is what we're calling our organization, but the full name is Tandem Community Birth Center and Postpartum House. Today, I'm here with Nikki. We're both board members. We currently have 4 board members at Tandem, and as our organization grows, we'll expand to 9 total board members. We have 2 more members likely to join in the next month, and we'll continue to add from there. And like Jody said, I'm from Bloomington. I grew up here, and I've bloomeranged after a career elsewhere.
Hi everyone, so I'm Nikki, and I actually am a former Rotary Fellowship Coordinator, so I'm a little familiar with Rotary, so it's good to be back. So I want to talk a little bit about what drives us and what drives Tandem. And one of the biggest issue is according to the CDC, Indiana is actually the 3rd worst in maternal deaths, meaning in mother deaths. This data is a little old. It's from 2018, so we'll kind of see what happens with the new data. But we know that there's an issue in Indiana. There's a lot of, if you guys have heard of like food deserts, there's a lot of maternal care deserts in Indiana where people have to drive more than an hour to get to their nearest provider. We also know that there are a lot of what we call near misses, so something that doesn't end in maternal death, but ends in some serious injury or a lot of mental health issues as well. We don't have numbers specifically for Indiana, but we know that conservative estimates suggest that 1 in 7 birthing people are experiencing some sort of mental health struggle after. And a lot of this is because there isn't really kind of like this continuum of care or any sort of like community structure that's built to support birthing folks. So we want to help change this. So one of our biggest goals and part of our mission is to improve these really objective maternal health outcomes. But we also want to create different options for people in our community. So everyone is going to be served by different options, and we want to make sure that those options are available. Like there are, I think, Julie can correct me, I think there's 2 birth centers in Indianapolis now. But is that right?
There's 1 open right now and 1 about to open.
Right. And there's some more, I think, in northern Indiana, but there's nothing really in southern Indiana. So we want that option for families. So our slogan is we want to catch babies, help families, and build community. And so let's go to the next slide. I'll show you kind of what that looks like. So there's 3 components to what Tandem is. So I think when I talk about Tandem and I say birth center, people might mostly assume like, okay, you're just going to be a birth center, you're going to catch some babies, and that's kind of like what you're going to do. Kind of like this like one-time event in people's lives. But Tandem is a lot bigger than that, or the goal and the mission of Tandem is a lot bigger. So One of the big components of Tandem is going to be this community care aspect, which is going to include a lot of different educational components. So starting this summer, there's a childbirth education. We also hope to expand to lactation education, postpartum planning, and kind of starting to talk to our community and see what the needs are. So it's possible that there's a class or that there needs to be community support and we're not even aware of it yet because nobody's really asked the community. So that's when we say community care and we say we want to build communities. A big component of that is this kind of educational component. Of course, the other big part of a birth center is the birth center. So we want to have a midwife-led medical clinic and birth center. So a birth center is usually a place where outside of the hospital system where babies are caught. But in addition to that, will also be a medical clinic. So we can provide other services before pregnancy and after pregnancy as well, kind of whole person care. So not just in that moment of pregnancy, but whole person. And yeah, we hope to open that birth center portion, so and the clinic in spring of 2022. We're going to have birthing suites that are going to have birthing tubs, and I think Julie might talk a little bit more about that. She's kind of the guru with that. So that's the catching babies part. And then the other part that I think is really fascinating that a lot of people don't know about is this component called a postpartum house. And this is really the aspect of like helping families beyond just the event of birth. So we hope to open a postpartum house in 2023. And this house can serve as drop-in services. It'll have classes, consultations, all of that. What I think is really awesome, and I've honestly, before connecting with Tandem, I'd never heard of this, but there's an option for 27 in-house postpartum support. So anytime kind of in that postpartum period, if you are feeling overwhelmed or if something's not going right, if maybe you feel like your baby isn't eating enough or you're not eating enough and you need somebody to feed you and make you drink water, the postpartum house is there for people to stay 24/7, and it's always going to have a in-house doula support, which I think is really amazing. So this is an option that people can go to if they give birth at the birth center and then they kind of want to transition to the postpartum house and stay for a little bit. They could do that. They could give birth at a hospital and then need some extra support and come to the postpartum house for a while. However they kind of need it, this postpartum house can support families long term, and it also is a big part. I'm sure Julie can talk about the financial component as well. It really supports the birth center as well.
So yeah, like she said, at the postpartum house, we're really excited to be able to support families beyond the actual birth. So what has Tandem been doing so far? It started as myself and my friend Hattie. So Hattie Katz is one of the co-founders of Tandem, and she is a midwife, and she also grew up in Bloomington. She left, she went to midwifery training in Florida and came back when professional midwifery was legalized in Indiana, only to find that in the current environment in Bloomington, she can't practice with her license, even though professional midwifery has been legalized due to restrictions around practice. So it started with her complaining, I'm here and I can't work. I can't do what I love. And we decided, well, let's do something about it. Let's fix this. Let's build a birth center. The deep irony there, of course, is that she won't actually be able to practice in the birth center as a professional midwife. She has to become a nurse midwife. So she's actually back in school right now at Ivy Tech, becoming a nurse midwife, first an RN and then a nurse midwife. But we have decided we're in this for the long haul. So she and I entered the Ivy Tech pitch off and won it. And that gave us a little bit of funds, $500 to go and say, let's make it official. So we've incorporated, we've gotten our 501c3 status. We developed a business plan, and then with COVID, we developed the business plan again to accommodate, understanding COVID-19 as a long term. It's going to be here really forever prospect. We have been working on grants, recruiting a physician, developing our community outreach, and now this summer we're very excited to launch educational services. Some of the barriers to us opening. One, birth center law is complicated. One of the things that's required in Indiana, not in other states necessarily, is that we have to have a collaborating physician to support the birth center. And in our specific community, most physicians are part of IU Health, and IU Health as a large entity doesn't have a policy of supporting external midwifery projects. And so all of those physicians are going to be bound by non-compete agreements. We have one independent OB in town who is looking very eagerly at his retirement prospects and not at being on call additionally for a new project. And so this presents a real challenge to us, but we have recruited a physician who's an Indiana licensed OB. We haven't made big announcements. This is hush hush, secret, top secret, new news. We haven't announced this broadly yet because we're still finalizing our contract with him. But we are confident that he's going to be joining us and providing the state required collaborative agreements that we need for our midwives to have prescriptive authority and for the birth center to operate. Zoning is rough. You know, no, Bloomington doesn't have any zoning code for a birth center, nor does the county. But we've been negotiating with the city, and they're willing to zone us as a medical clinic. The county currently wants to see us as a hospital. So that just means that as we look at facilities, we're likely to stay inside city limits because medical clinics can go in many more locations than a hospital can. Fundraising, we know, is always difficult. The pandemic has taken all of our clever ideas and made us have to rework those, and we're continuing to strategize for fundraising. And then just the space, you know, in addition to zoning, we have the state laws give us very specific requirements about what the space can look like. I think the only thing more regulated than a birth center in terms of the facility requirements is an abortion clinic. So I'll let Nikki pick this one.
Yeah, so kind of as Julie mentioned, fundraising during a pandemic, as I'm sure you guys are aware, has taken on kind of a whole, it's a whole new beast. So, you know, the team has really been focusing on several grants. I think before we were talking about the Jack Hopkins grant, but there's a few other as well that the team is working on and kind of going through this long process of trying to get some grants in order to primarily support a location right now, and so that we can kind of get a physical location. We also have been kind of really focusing on kind of grassroots fundraising. So we launched a $40 campaign, which we were asking people who had signed a petition earlier, I think in 2017, maybe. There was a petition that went around that 1,000 people signed saying that they want expanded midwifery care and birth center options in our community. And so the $40 campaign was this grassroots effort to try to reach those people to be like, hey, if everybody just gave $40, we could hit our goal and then kind of like move on to the next project. So that was a big kind of grassroots campaign that we're still running right now. Another kind of tangential fundraising, not tangential, but physical fundraising strategy we had was to make gift bags for the holidays this year. So you have these really cool, there's a postpartum gift bag, there's a pregnancy gift bag, there's a sibling gift bag for like new siblings that have all sorts of cool stuff. There's balms in there and teas and all this different cool stuff. And we did it for the holidays, but it was such a success that we've kept doing it. And so people can still purchase these gift bags and you get like a cool tandem bag with all these goodies in it. And then we actually expanded that as well. So people can sponsor bags. And so you purchase a bag and then it's given to a community organization in town. I think El Centro, Hannah House, and All Options right now are the current community partners who are receiving bags. So that has been really cool as another option for people who maybe don't have pregnant folks in their life, but want to support our community. And we were surprised at like kind of how successful that's been. So that's awesome. The next things we're looking into, especially when we get the space, is having some sponsorships. So right now we're looking at options for naming the birthing suites. So Tandem hopes to have 2 birthing suites. And then we're going to ask for $20K for like for name recognition. So you could name a birthing suite like after your company or yourself or whatever. And that's going to happen hopefully as soon as we have this physical space, and you'll be able to name a birthing suite after. The 5th thing we're kind of looking into, and I'm sure you guys have creative ideas on this as well, like how to have a physical fundraiser. We're trying to figure out the logistics of what an online fundraiser would look like, what could draw people in, how could we also like continue to build this community while raising funds. And so we're looking into different things we might be able to do online while we're still kind of in this in between time. And then the last strategy we have, which I'm really excited about too, is having quilting squares. So having a fundraiser with quilting squares. And the idea is that if you guys have been to Wonder Lab ever, when you walk in, there's like a wall and there's like bricks and they have like messages or people's names on it. And those are kind of like the early funders of Wonder Lab. And we thought that's so cool. Like it would be so neat if like people walking into the birth center could like see all these people that like help build this birth center. So we're going to sell like space on a quilt. And so you can make a little drawing or have a little saying, or I don't know, like your kids can make a little image. And then we're going to make it into like a big giant quilt that'll be in the wall of the birth center when you walk in. So that's kind of our final fundraising strategy that we're looking into.
And then the last challenge, location consideration. So we've set this, the $40 campaign was really driving towards this $40,000 goal. We determined, looking at our budget and funding, that if we can hit $40,000, that's the point where we will feel comfortable leasing a space, because we know once we have a space, we're going to be able to generate additional revenue to keep us going and to begin the service offerings that will keep us going. And we feel like $40,000 will give us enough padding to be able to invest in that space. So all of this fundraising effort has been focusing on hitting that first $40,000 goal and then going from there as we continue to fundraise. We have significant licensing requirements for this space. So we have a volunteer architect who's already agreed to volunteer all of his time to design whatever space we end up in, such that it will meet those requirements. And we also have a volunteer carpenter who's volunteered to lead builds, like a Habitat for Humanity style build in the space in order to get the work done. So that should help limit our costs to materials. We want to be within 15 minutes during rush hour traffic of the new hospital. So we're predominantly looking on the east side and trying to stay within city limits. And we expect to be leasing a space, but we've also begun talking, for example, we looked at a specific space with Lauren Wood, thinking that perhaps he would be willing to invest in it and then lease it to us with a long-term lease. That space ended up having some issues with it that may make it not possible for us to get that space licensed. But we're looking at that model for other spaces as well, potentially seeking an investor who's willing to purchase the space for us and then lease it back to us. So what are our values? Why are we here? I've had 3 births, none of which have been at a birth center, but one of which did leave me with PTSD and was very traumatic. And so we are really here to try and help everyone in our community access birth without trauma, regardless of where they choose to give birth, no matter how they choose to give birth, whether they're birthing at the birth center or not. They can access our educational services. They can come to us for prenatal care, even if they ultimately decide to go to the hospital for birth or have a home birth. The postpartum house will be open to everybody. We'll be bringing in contracted service providers to provide supportive services so that everybody can learn about postpartum mood disorders. Everybody can learn about pelvic floor physical therapy. So many people give birth and are having issues with their pelvic floor, with prolapse, and they've never heard of it. It's never been mentioned. And so, one of the things I haven't mentioned in this presentation is Bloomington Area Birth Services was in Bloomington for a long time, and they ultimately closed due to fiscal insolvency issues. But they were very much needed and very much desired in the community. They just hadn't figured out how to operate in a way that was sustainable. So we've done a significant amount of work interviewing anyone and everyone we can find who participated with Bloomington Area Birth Services, with BABS, to understand what made them successful and what led them to not be able to continue to operate. And so we feel that our operating model is sustainable. We know that we can, by centering it around medical care, where we can accept cash payments, accept Medicaid, and ultimately negotiate insurance contracts, we can ensure that we're receiving enough income. We expect to operate in the black, actually, once we're fully operational. We just need funding in order to start up. And then later, if we seek grants, it will be to supplement services or expand in a specific area or add more services that are free or reduced cost, have more scholarships. So we feel confident that we have a model that will be sustainable. We know that BABS was supporting over 600 families a year with education and prenatal yoga and support classes. So we know that this gap, since BABS closed about 5 years ago, is very felt. We hear about the loss and lack of BABS regularly. And so we hope to fill some of that gap, not to be BABS, but to fill some of the gap left by BABS. So yeah, that's who we are. We want to grow a birth center, and we'd love any feedback you have for us, or questions. We'd be happy to answer any questions you have as well.
Going to go ahead and let you stop sharing your screen, and then we can see if people are asking questions. Like Jody's unmuted. If you want to ask a question, Jody.
I was just going to say, I'm glad you guys were able to find a physician. I know that was one of the big obstacles we talked about when we had our discussion. So I'm glad that hurdles.
It's huge. It's huge.
I think this is definitely really necessary part of our community. So I'm glad to see it happening. I personally, since I've been in the community, have not needed these services, but I always supported BABS because I had friends who used them and used their doula services and things. And it was always just a nice, safe space. And I think the postpartum care is amazing. And anybody who, had small baby, just to be able to walk in and say, I haven't showered in 3 days and I'm exhausted because I'm not sleeping, and can somebody safely care for my baby so I can take a shower and get a meal and take a nap? And that's just critical. Not everyone has that support through their significant other or through family or whatever. And so I think that's so unique and so important. So really excited about everything you guys are doing.
Yeah, I'm going to tell my sister about it. My sister actually delivered here in Bloomington via midwife 19 years ago. It was not legal, but we did.
Yeah, the professional midwives, most of them in Bloomington have license. The reason Hattie can't practice as a professional midwife here is that there's a limit on how many, they're called, the new licensure for professional midwives here is direct entry midwives. There's a limit to how many collaborative agreements an OB can have with direct entry midwives. So we only have one independent OB, that's Dr. Laban, and he's signed his maximum quota of collaborative agreements. And so he can't take on a new one, and he's just not willing as well. He's he's on call 24/7, 365. He's full up, right? And so without another physician willing to sign a collaborative agreement in town with a professional midwife, it completely prohibits her practice, even though she meets all the other requirements for practice. It's unfortunate.
So do you look to expand beyond Bloomington, or do you want to focus mainly at Bloomington, Monroe County?
So we're trying to focus our services on Monroe and surrounding counties. You know, there is no hospital in Brown County. I don't think there's any obstetric services at all other than traveling midwives into that area. There's, you know, an emergency room in Eastern Greene County. There's a hospital in Bedford, but I know that the professional midwife who operates in the Bedford region, if she has a transfer, she transfers to Bloomington Hospital just for the quality of care and services.
Yeah, I don't know that either of the Bedford hospitals are doing births anymore.
Yeah, yeah, and additional like services are continuing to close. We're continuing to see places where they have some limited offerings continuing to either say we're closing our doors, or well, we're still open now, but give us a few years, we'll be shut down. So we see us as ourselves as a service to Monroe and surrounding counties. Now, the postpartum house is a really unique thing. This is inspired more by other cultures outside of the United States than it is by any kind of American tradition. And we think it will be the first of its kind, not just in Bloomington or in Indiana, but in the country. We have not been able to find anything operating like we have envisioned for the postpartum house in the entire United States. That doesn't mean it doesn't exist, but it certainly will be unique to our region. And we see potentially the postpartum house, because we'll be taking overnight stays, could potentially take, you know, somebody who gave birth in Indianapolis or several hours away, who wants to come for a week stay. Maybe they're 2 months postpartum and they want to come for a week and sort of reset, get some help, get some sleep, and that could be a person who's able to pay full cost, and then that is able to fund us accepting, you know, more people who are on our sliding scale or coming at a reduced rate. And the postpartum house is one where I see maybe we end up helping people start their own postpartum houses in other communities, because it can both has the potential to self-fund once it's open, and it's just so needed. It's just, I have a friend who you know, gave birth as a single parent, and her pregnancy was timed, she's a teacher, and her pregnancy was timed perfectly with the end of the school year. And she had all this support lined up for, she was going to finish the school year, she was going to give birth, and everybody, all of her fellow educator, school involved people were going to be available to support her. And then that baby came early, a week before the school ended. And all of her support was like, well, we'll be with you in a week. But until then, good luck. And so she's like, if I could have just checked in, we see, you know, this is something people could ask for as a baby shower gift, pitch in for my postpartum house stay. And like a meal train, you could hold on to that and say, like, you know, maybe I could use this right after I give birth, or maybe I'm giving birth at the hospital, I'm going to stay there a few days and then I want to go home and get settled. Maybe I'm going to save it a month or 2 months out and come in, you know, when some of that initial family and friends excitement and support has kind of dwindled, the meal train has run out, but you're still exhausted, you're still struggling with feeding in the middle of the night, you still haven't showered for 3 weeks, you know, that's the time you decide to come in and really get that personalized care and attention.
Yeah. Charlie?
I'm going to throw out a name, and maybe Tim will agree with this, but a contact on the east side would be Norman Deckard. He owns all the Williamsburg Village along Pete Ellis Drive and so forth, and in behind where Staples is. I know he's got a couple vacant spaces, but he's just an A1 person and an awfully nice guy. So
Thank you. Yeah, we've actually been looking a little bit at the Williamsburg Village area, and we knew that Monroe County Martial Arts closed down recently, and I don't think that space has been filled yet.
Norman Deckard is the person, and his, I guess it would be ex-son-in-law is kind of taking over, but they're both quality people.
So I'm curious,
Oh,
go ahead, Jody.
Nice. I was going to say, I have a question. You mentioned that, 99% of the physicians in town are tied up with non-competes with IU Health, and it doesn't allow them to, participate in any other healthcare system or setup other than IU Health. Have you, I'm trying to find a politic way to phrase this. Have you, as this has you've started this process, have you gotten any pushback from IU Health or providers?
So we haven't gotten any pushback. We know some providers at IU Health who are very excited about this, but can't necessarily directly participate. We had originally scheduled, gosh, right before everything locked down. I want to say like the first week of March 2020, we had a meeting set up with a manager and the director of the labor and delivery unit at IU, where we were going to chat with them about what we were doing and how we were intending to make sure that when we have transfers, that those are safe and that we're communicating well and transferring charts and information correctly. And the day that we were supposed to meet with them, they no-showed on us, and the manager and the director, as of that day, were no longer employed by IU Health. We don't know the full story there, but they didn't come because they were no longer working there. So we know they've had some turnover throughout the pandemic, and I believe they're hiring again. So we've decided to just sort of sit and wait for them to stabilize before we try and make contact again with that specific department. So we very much want to have a positive working relationship with IU Health. We know that it's essential for the health of our patients. Only patients with normal, healthy pregnancies are eligible to give birth in a birth center. I can't give birth in a birth center because I've had a cesarean birth. So Indiana law prohibits vaginal births after cesarean in birth centers. I could go get my prenatal care at a birth center, and if I were to have another pregnancy, I 100% would do that because I have a very strong preference for the midwifery model of care and the way I received care through midwifery services. But even only taking normal healthy pregnancies, we do expect to have some transfers, and sometimes those transfers, most transfers from other Indiana birth centers, their records are non-emergent. It's somebody who's got a long, non-progressing labor, and they're ready for a little bit of Pitocin, ready for some pain management, and they want to go to the hospital. But occasionally it is emergent, and in those cases, we want to make sure we have extremely clean and clear policies and procedures relating to that transfer, and that we have a positive relationship such that when they come in, the hospital is ready to take them and give them the highest quality of care, because some people need more care, and that's okay. Some people need a higher level.
Lord Lillywhite, did you have a question?
Oh, I just wondered, and this is just my problem solver brain, which might be asking a stupid question, so by all means tell me. But does it have to be a practicing doctor, or can it be a retired doctor or somebody who's willing to supervise that way? I only think about that just because I work with a lot of retired doctors in my practice. Yeah.
So the physician, so the there are a few elements that are required, and then there's sort of the nice to haves. And the physician that we found at this point is only going to be fulfilling the requirements, which are one, to sign collaborative agreements with our advanced practice RNs, which are the certified nurse midwives. And that means a regular review of a minimum of 5%, I think, of charts and prescriptions, and other very basic elements of a collaborative agreement. And then within the birth center, the physician has to conduct staff meetings at least once every 6 months with all medical staff, and sign off on all of our policies and procedures, participate in chart reviews. There's a birth center that recently opened just south of Fort Wayne, Indiana, that also has a physician who's fulfilling sort of the bare minimum. Our physician will also be named on our lab. We'll be doing very basic labs like pregnancy tests, looking at urinalysis, but no complicated laboratory work will be done in the birth center. That would, anything like a pap smear, we would send out to another lab. But our physician, we have to have a physician for CLIA certification on our lab work. So this new birth center south of Fort Wayne, they have what I call the bare minimum physician, and their physician is working about 40 hours per year for their birth center. That's about the requirement needed. It doesn't have to be an OB. So they have a family practice physician. I think if they're retired, they would need to be maintaining licensure.
Sure.
But beyond that, they're literally the law, the rule says physician, and that can mean MD, DO. It's pretty minimal.
I think John's point is, though, that you might be able to tap into the retired community.
Yeah,
It's a
Like
normal
I can
thing.
think of one client that would probably be a really good fit, and I think I would be happy to talk to that client and talk to you if it made sense. And
I
it
would
might
love
be
a connection. Yeah.
Yeah, it might be more than a bare minimum situation. So I don't know.
Yeah. Well, and so the nice to have, what we truly love to have is a physician who is willing to take our patients when they transfer to the hospital, so that they already have a relationship with our midwives. And if we need to transfer, that they're in a place where they can follow our patient to the hospital and ensure a very smooth transfer.
Sure.
What I forgot to mention in all of this is HealthNet. So you're probably more familiar with Volunteers in Medicine, but Volunteers in Medicine has recently restructured and become acquired by HealthNet, which is a federally qualified health center based in Indianapolis. And by doing that, by reorging in that manner, they now can accept all patients and expand into many specialties. So they've already expanded into pediatrics, and my understanding is they will be expanding into OB soon and offering actual pregnancy care. Now they're not going to have a hospital. They're going to take their patients. Presumably they'll have an attending OB who has privileges at IU Health and will catch babies at the hospital here. But we understand that they are going to have nurse midwives as well. And we had originally been talking to them about maybe having some kind of agreement with whatever physician they recruit for HealthNet, also providing services for our birth center, providing the required services. And that does exist in some other states in the US. There are other federally qualified health centers that have relationships with birth centers, not in Indiana. But it was always going to be very tricky from a legal standpoint. So now that we have this physician that we're working on finalizing our contract with, who's going to do that bare minimum, we're even more excited about HealthNet, because we can maybe avoid all of that legal relationship. Nobody has to sign and say that they're going to provide collaborative services for our midwives. But maybe if they have midwives, we can grant their midwives privileges at our birth center, and they can catch babies, which they might not be able, they may not be able to do at IU Health. Maybe their OB would be willing to work with us on transfers, even if there's not a legal relationship where like they're connected to the birth center in that way as like a medical director. So we're still very much in conversation with HealthNet as they expand.
Go ahead, Charlie, and then I've got a question too.
So if there's a physician that works for IU Health, can they still work with you, or does that put them in jeopardy with IU
Yeah.
Health?
They can't sign any, if the physician works for IU Health, they can't sign any agreement with us. But if we take, for example, if we have to do a transfer and we've got our bare minimum physician providing our legal agreements, and we go to the hospital, there's always an OB on call at IU Health Bloomington Hospital. And so we would just go and say, this is our patient, here's the chart, this is what's going on. We're transferring to you, attending OB on call. And then that's fine. I mean, their OB can definitely take our patient and should take our patient. But the problem, if that's the situation, is that they don't know us. You know, it's just whoever's on call.
And that's one of the people I was thinking of. So I'm going to have dinner with them in about, well, next weekend. So I'll talk to her about this.
Yeah, that'd be lovely.
So my question is, the postpartum house, does that have all the same legal requirements, having a doctor and having a hospital or I can't remember what you call it, a pharmacy or whatever
Wow.
zoning, or is it completely open on those requirements?
So the postpartum house, we're looking at some facilities where everything would be housed in one building. And we're looking at also the option of having two buildings where like the postpartum house could be a little bit farther, maybe on the edge of town where we get a cheaper per square footage price. And therefore can have more space for more rooms. Postpartum house is not medical care. Postpartum house is staffed by doulas who are not clinicians. And while we will have like blood pressure cuffs or temperatures, that will be for patient self-monitoring. We hope our doulas are trained as patient advocates. And we very much expect our doulas to help patients advocate for themselves if they're experiencing symptoms postpartum that may need medical attention. And we will certainly encourage them to seek medical attention if we think they need it, whether that's going to the birth center or our medical clinic to get that care, or that's going to an OB or an emergency room. But no, the postpartum house, you could think of it as a short-term stay group home or as a nonprofit hotel. It's closer to those models than to any kind of medical model. From a zoning perspective, we're dealing with laws that were written thinking about Airbnbs, where they're trying to reduce short-term stays. The county has been very favorable on the postpartum house side, and the city we haven't gotten as far with. So
The reason that I asked my question is, to me, it seems like putting together the postpartum house, A, would have a demand, B, would be able to produce money, and C, is a lot easier to get going. But yet you have it third on your list of things you want to do. And I mean, I know complete outsider, don't know anything I'm talking about here, but it seems to me from a business perspective, that you could almost do that first and start generating income to then be able to fund your other things, as well as there'd be a lot more places that you could easily do that in all these other counties by time, because churches and all kinds of places would be willing to help with different things on that front. And when you don't have the same medical needs, that's just an idea.
The postpartum house was originally our plan lead service. So that was going to be first until the pandemic. And with the pandemic, we began to see the need for the birth center just increased, because we have people reaching out to us regularly through our Tandem phone number and email address saying, hey, are you going to be open in like 6 months? Because I don't want to go to the hospital during a pandemic. But as the pandemic has evolved and continued, we do see the potential to bring that postpartum house online earlier. And especially if we found a facility that could operate had enough space to be both, we just have to sort of draw a line within the facility that delineates, like, this is the birth center side that has to be inspected by the state and the rest is not inspected. And that's, you know, there are other birth centers in Indiana where the state comes in and they say, okay, you inspect everything on this in this section and ignore everything else because that's not the birth center. So yes, as the pandemic has evolved, we are considering bringing the postpartum health up some, depending on what we find in terms of facilities. Once we've hit that initial $40,000 mark, but we have decided that because we have this physician, we're going to keep working towards the birth center, you know, as our first priority.
Yeah, and I think what Julie too, like that was the plan, was to start with the postpartum house to get funds. But what happened with the pandemic is there was so much unknown, and bringing newborn babies into a place that could potentially spread a disease was seen as something that we didn't know and was too much of a risk. And so that's why, you know, we kind of had to pause that postpartum house, even though I think, and Julie has the model, but that's going to be supporting a lot of the birth center costs as well.
And I wanted to thank you both. We've had a couple people already jump off because they had to get back to work. We have a few more. We are recording. We'll be putting this on YouTube. I hope that's all right. But thank you both very much for coming today. We really appreciate it. It's very informative. I know we all wish you the best. And it sounds like a few people are going to try and make some connections for you. So yeah, thank you. And does anybody else have any other questions? I'm looking at dark screens, so I have no idea. I will assume not. I'm going to stop the recording now.